Hello and welcome to abxtracker.com, where we provide solutions for antibiotic stewardship to long-term care communities. In this video, we will review the first tab in the menu, the new Antibiotic Tab. Examples of when to use this tab would be when a new antibiotic is coming in from the outside to your facility. These would include on admit from a hospital, on admit from the community, if the patient leaves for an appointment with a provider and comes back with an antibiotic, if an antibiotic was originally prescribed via an SBAR form, then DC'd due to the fact that a pathogen wasn't sensitive to the original antibiotic was not effective, or an adverse event was experienced with the original antibiotic, and because of this, a new antibiotic was prescribed in its place. So basically, if an antibiotic was prescribed originally off of an SBAR form, and then was replaced for whatever reason, you would enter the new antibiotic here. If a provider rounded on a patient at a facility and an SBAR form was not filled out, but an antibiotic was prescribed during the rounding, you would also use this tab. Also, if no antibiotic should be written or prescribed from a written fax, all faxes should be generated with abxtracker.com, printed in whatever format, and then sent to the provider. Also, since topical eye and ear antibiotics are not used as often, you can enter any topical eye or ear antibiotic for tracking here using the appropriate button. Right now, there is no SBAR for a topical eye or ear infection, since really there is no criteria to follow in terms of what criteria needs to be met to warrant an antibiotic. Phase 3 of the release will likely contain an SBAR to use for this. For now, please enter all topical eye or ear antibiotics here for tracking. So after you log in, you'll see the welcome page. The menu is on the top as usual. You'll see the new antibiotic tab within that menu. We need to click this. You'll see two buttons, the new antibiotic, oral, IV, IM for tracking, and topical eye and ear antibiotics. Click the appropriate button to begin, and a form will pop up on the next page. Let's start by clicking the new antibiotic, oral, IV, or IM for tracking. It brings up this form. Please type your name here. First name is fine. First name of the patient. Last name of the patient. Medical record number. Be sure to get this medical record number correct, as this is how the system connects antibiotics the patient is on. I would always recommend double checking this number. If your facility medical record number contains letters or any other special characters, these are not required to be entered. Only numbers are required. Again, only numbers go here. Please enter the patient's date of birth. Enter the date of antibiotic start. Typically, this is the current date. If the patient is coming from the outside on an antibiotic, please enter the current date, as we are concerned about the antibiotic starting on the day they arrive at the long-term care community. The next field is the patient room number. This is another important field to get right. Double check, as this is how we connect the infection to the facility map on the report level. If your facility map has 2 beds in a room, A or B, or 1 or 2, please enter that here. If the patient's room number is a single room, please indicate that by clicking private or single room. You can then enter the medication name from a drop-down menu. Enter the route of administration via the drop-down menu, oral, IM, or IV. Enter the dose of the antibiotic here. Please enter in milligrams. The frequency of administration via the drop-down menu here. The duration in days. You can either just type the number or the number and the label. Or the label. The next spot is a checkbox. Please check this box if the medication is ordered as a prophylactic antibiotic and there is no stop date noted. This will trigger the system as such and spit out the right report when generated. Next are the list of diagnoses. Please click off on the right diagnoses. If you do not see a diagnosis for the medication listed here, please go down and click Other Infection or Diagnosis. This will prompt you via a text box to enter and type the correct diagnosis into the field. The next one is type of infection, or where it was acquired. Your options are community-acquired infection, hospital-acquired infection, nursing home-acquired infection, or other nosocomial setting, or unknown. The next field is location prescribed. So where was the antibiotic prescribed from? Nursing home, hospital, emergency department, or medical office. And last field is the prescriber's name. Then we click Submit for tracking. Your antibiotic is now tracked and you will be brought back to the welcome menu. The other button in the new Antibiotic tab is Enter Topical Eye or Ear Antibiotic. Let's click this. It brings up a form which you fill out. Patient first name, patient last name, patient's date of birth, patient's medical record number. Again, this is important to get correct as it links the patient's antibiotic use for the entire system. Please double check. Enter your name. Your first name is fine. Enter the room number. Again, this is an important field as this is how it links to the facility map. If your room number has more than one bed in it, indicate that here. A, B, 1, 2, or private. The antibiotic start date here, which is typically the current date, which it defaults to. The medication name gets typed out as there are several different topical eye and ear antibiotics. The route of administration. The strength of the medication. For example, if the order reads gentamicin 0.3% eye drops and still 2 drops 4 times daily, you would enter 0.3% here. The next is the amount to administer. So let's take the same case. If the order reads gentamicin 0.3% eye drops and still 2 drops 4 times daily, you would enter 2 drops 4 times daily in this field. Another example, if the order reads clindamycin 1% topical solution, apply a small amount to the face twice daily, you would type apply a small amount to the face twice daily in this field. For our purposes, we'll stick with our gentamicin order that read instill 2 drops 4 times daily. The next field is the duration of therapy, which you can enter in days or hours. Whatever you do enter, please make sure you enter the label with it. So if, for example, if the order is 10 days, you'd enter 10 days here. If the order reads 48 hours, you'd enter 48 hours here. Or if the order reads, in this case for conjunctivitis, past 48 hours past the symptoms, would go here. And then lastly, the diagnosis for the medication. Gets typed out there. Also the prescriber prescribing the medication as well. Now that we have our information in, we hit the Submit and Track button. Once that is done, you'll be brought back to the welcome screen. All your information is now tracked and reportable in our report section here, which we will go over in a different video. This concludes the review of the new Antibiotic Tab. Thank you for watching and utilizing abxtracker.com for your antibiotic stewardship needs.